Hello, today we're going to be doing an assessment of the abdomen, kidney, and urinary bladder. This is my patient, and I will be having him lay supine to begin the exam. So first thing you want to do is maintain your patient with the most privacy that you can. So you only want to lift part of the gown or shirt, whatever they're wearing, up to where you need the abdomen to be accessible visibly. First we want to inspect. We kind of just look at the abdomen, check for temperature, color, symmetry. If they have a flat abdomen, round abdomen, if you can notice any peristaltic waves, any rashes, scars, or any excessive striae that the patient may have. After inspection, you want to auscultate. I do want to start at the right lower quadrant. For auscultation, you have to auscultate prior to percussion and palpation so that it doesn't disrupt any sounds or any movement in the abdomen. For auscultation, I am going to start on my right lower quadrant and work myself clockwise. And here we're checking for any presence, characteristics, or bruits of the abdomen, of the gut. If you do hear a bruit, it can mean a carcinoma or hepatitis. We are checking if the patient has normal, hyper, or hypoactive bowel sounds. If your patient doesn't have any bowel sounds, you do want to keep listening for 3 to 5 minutes in each quadrant to make sure that it's just not a slow sound. After auscultation, we want to percuss in the same order. We want to percuss for any tympani, dullness, or area of change. Depending on where you are on your abdomen, your sounds may vary. So same thing, we're going to percuss starting at the right lower quadrant, working yourself clockwise. And I do want to note that I would normally have my patient facing the other way, so that I am at the right side of the assessment, but due to later assessing the spleen, I do need the patient to be able to turn on the right side, which is why I have him opposite direction. After percussion, we do want to ask the patient to flex the knees, just so that he can relax the abdomen a little more. After he flexes the knees, I want to do a light palpation, and I'm only assessing for masses, any tenderness or guarding that the patient may have. Again, I'm going to start at the right lower quadrant and work myself in the same direction. If the patient is guarding or any tenderness, you kind of have to look at their facial grimaces. This is where they would actually express a lot, just by their facial grimacing. Later, you do want to ask the patient to mouth breathe. So go ahead and take a deep breath. After exhalation, you want to do your deep palpation. You want to assess for the liver edge, masses, tenderness, pulsations, guarding. If the abdomen is rigid, that could mean peritonitis or any rebound tenderness that you would see with appendicitis. The liver, we want to estimate the liver size along the right mid-clavicular line, and we are going to percuss to assess the size of the liver. Usually it's 6 to 12 centimeters down the right mid-clavicular line, right beneath the costal margin. So you do want a deep palpation and see if you can assess, we're doing percussion. So we're doing the percussion of the liver. After your percussion, then you want to move into the palpation. Same spot under the costal margin, and you would palpate. You would notice if there's any like bumps, lumps, any tenderness that could mean hepatitis. Then you want to move on to the spleen, which is located in the left side, 6th rib anterior to the axillary line, and down the costal margin. So you want to see where the last costal margin is, and then mid-clavicular, or mid-axillary, Here we're going to percuss the spleen, and notice for any tympani. If enlarged, you would hear a dull sound when the patient inhales. So if you were to have the patient take a deep breath and I palpate and it's dull, then the spleen may indicate that it's enlarged. After that, we're going to palpate, and this you also want to do with the patient laying supine. So you want to palpate for the spleen. And this is at the same location that you're doing the percussion. Another way to palpate the spleen is to have the patient lay to the right lateral decubitus position. This is your right side? No, the right side. So with my left hand, I'm going to reach over and I'm going to leave my right hand right under the costal margin to the back part of the chest. And I'm going to deep palpate the spleen. I'm going to press in toward the spleen. Okay, now I'm going to check for CVA tenderness. So I do want to have my patient sit up, and I am checking for costovertebral angle tenderness using a fist percussion. During percussion, there should be no tenderness at all. If the patient were to experience tenderness and state that they have dysuria or fever, it could mean that they have pyelonephritis. I'm sorry. So we do want to do a fist percussion bilaterally. And this is your main indication if a patient has going something on with your renal part. We would ask the patient to lay back down just to check the urinary bladder. You want to check for any distension. Make sure that you have your patient on an empty bladder to make sure you don't cause them any reason for them to be uncomfortable. So I am going to do percussion 5 centimeters above the pubis symphinus. Would be right here, and you should hear a tympanic sound. After that, you want to palpate the bladder, and your bladder should not be palpable unless it is distended or you have a full bladder. And that concludes the abdomen assessment.